Yeah. So the question is, which of the following is the optimal way to determine malignancy in a patient of adrenal incidentaloma? So the answer here is option A, non-contrast CT and measurement of Hounsfield units. So before going to this question, let us discuss few basic things about adrenal incidentaloma. That the incidence, what is the incidence of adrenal incidentaloma? So the incidence of adrenal incidentaloma is 10 percentage in patients with age more than 60 years, and usually in young patients the incidence is around 4 to 6 percentage. So what is an adrenal incidentaloma? It's as simple as that when a patient undergoes CT scan for any other reasons and there is an adrenal lesion which is picked up incidentally on the scan and reported, and the patient reaches the OPD with the scan asking you what to do. So the basic thing we need to understand here is that whenever you encounter any incidentaloma in your practice, and the first thing that you need to ask whether it is unilateral or bilateral, because most of the time if it is bilateral and if the patient has history of malignancy in the past or right now, so this can be a metastatic lesion, and for metastatic lesions the treatment will vary. And if it is a unilateral lesions, the second thing is we have to confirm whether it is benign or malignant, because malignant lesions we have to operate, benign lesions we can observe, and we need to know whether it is functioning or non-functional. This is very important because most of the adrenal incidentalomas are not functional, like as high as 80 percentage or non-functional. So in the evaluation what we need to do is that first we need to ask a history. In history you have to ask whether the patient has any history of malignancy, any malignancy, and if the patient has hypertension or low potassium, all this will point towards mineralocorticoids. And then if any features of increased glucocorticoids, all this will point towards Cushing syndrome. So after history, that we need to go ahead with diagnosis. In diagnosis, the best way and the optimal way to confirm benign as well as malignant lesion is first perform an NCCT and see the Hounsfield units, and if the Hounsfield units are less than 10, then international unit, then that's going to be a benign lesion, and if it is more than 10, that's going to be mostly a malignant lesion. So if this test is the easiest way to know whether it is benign or malignant, then you can proceed again with finding out the functionality of the tumor. So if this test is inconclusive, then you have to perform what's known as the CECT with washout study. As you know that these adrenal incidentalomas, if they are malignant, they will have low washout of the contrast, rate of washout. Next is you might have to do an FDG PET scan, and then you might have to do MRI studies, all these things. So the answer to this question is the optimal way to diagnose benign versus malignant in adrenal incidentaloma is NCCT. So certain features of malignancy on the CT scan would be like if the lesion is irregular, or if the lesion has a size more than 4 centimeter and Hounsfield units are more than 10, and if there is any necrosis, a hemorrhage, vascularity, increased vascularity of this lesion, low contrast washout, like absolute and relative washout, they will be calculated by the radiologist. It's less than 60 percentage, less than 40 percentage. These are important values. And coming to the management of these lesions, so the management will depend on the age of the patient, the size of the lesion, nature of the disease, whether it is benign, malignant or functioning and non-functioning. So as simple as that, the rule is if the size is less than 4 centimeter, non-functioning and benign, it will be observed. So observation will be in the form of 6 to 12 months CT or MRI. And those lesions which are more than 4 centimeter, they will be operated, and it can be done either open as well as laparoscopic. Laparoscopic adrenalectomy can be done till 6 centimeters. But if there is any features of infiltration to the surrounding organs, then it's better to perform an open resection of the adrenal gland. Thank you.